Today I'm performing the Perfect Derma Peel without a booster on our patient, Ken. The Perfect Derma Peel is an excellent treatment for male patients because it's virtually painless, requires very little downtime, and has a very easy post-peel process and recovery. Ken's already washed his skin, but I'm going to prep him with acetone. For patients who have thick, oily, or resilient skin, you'll want to do a couple of strong passes with the acetone. For patients who have dry, thin, or sensitive skin, fewer passes are generally required. And again, the acetone is going to serve to thoroughly cleanse and degrease the surface of the skin so that the peel can penetrate evenly. And after the first light pass, I'm going to take just a few seconds to pause and observe his skin to make sure that there's no visible frosting. Also, I want to check in with my patient. Ken, how are you feeling at this point?
I'm feeling great, actually.
Oh, good, good. So you're very comfortable?
Yeah.
Wonderful.
Yeah. I felt it working.
Great. So I don't see any frosting at this point, so I'm going to go ahead and start my second pass. Now with the second pass, I'm going to do a firmer application. And even though Ken has basically good skin, he does have some areas of pigmentation. So I'm going to do multiple passes over the pigmented areas to help lift that. For pigmentation, we generally do recommend a series of 3 peels, spaced about a month apart for optimal results. Of course, that can vary with the patient, but in most cases, we do require three peels to see a dramatic improvement in the skin. I like to pay a little special extra attention to the nose area. Many of us get blocked pores or enlarged pores around this area, especially if we're over 40. So you can be a little bit more aggressive in the T-zone and especially around the nose. And again, I'm just going to pause for a minute and take a look at his skin. I want to make sure that there's no moderate to heavy frosting. Ken, how are you doing? Do you need a fan?
Yeah, I think I do.
Okay, go ahead and feel free to use a little fan. And Ken has a little bit of a light frost on the side of his nose, so I'm not going to continue around that part of the nose any longer, but I will continue to layer it on the rest of his face, especially where he has pigmentation on the cheeks and a bit on the forehead. And is your skin, is it more numb now?
Yeah.
The phenol does numb the skin, usually after about 60 seconds, so there's very minimal discomfort, if any, after the first minute or so. You're doing great. It's also important to remember to always use the entire vial of peel solution unless your patient has a lot of frosting over the face. You want to do a generous application for best results. Okay. At this point, I'm going to go ahead and peel the eye area and the neck because I've used almost all of my solution. I'm just going to do a light pass under the eye. And finally, I'm going to do a couple of light passes on his neck. And just lift your chin up for me a little bit. Just your chin. Thank you. Great. Okay, and he's done. So the peel itself generally takes 10 to 15 minutes max. You'll normally want to book out about a half-hour appointment though to explain the aftercare. It's really important to answer your patient's questions and to make sure that they understand how to properly care for the skin post-peel. Finally, it's going to be really important to walk through the post-peel care with your patient, especially since this is his first peel. So Ken, I want to just show you what I'm going to send you home with today. So you'll be taking home this post-peel care kit. It's very simple. We're going to give you an instruction booklet on taking care of your skin, 2 post-peel towelettes, which contain retinoic acid, glutathione, and vitamin C. And then you'll be getting our post-peel cream, which contains 1% hydrocortisone. It's an anti-inflammatory. And then finally, our Mineral Perfection SPF 30. So you'll be using all of these at home the first week post-peel. For For today, I want you just to go home and leave the peel on your skin for at least the next 6 hours. Try not to touch your face. Definitely don't wash or apply any products.
Okay.
After 6 hours, you can wash it off if you want, or you can wait till bedtime. It's really up to you. The peel self-neutralizes, so it's not going to harm your skin. If to leave it on longer, it's not going to cause any issues to leave it on longer.
Is it better if you do leave it on longer?
You know, it really isn't necessary. It's going to do its job in 6 hours. So it's really whatever's convenient for you. We really try to formulate the product to be easy and convenient and just simple to work with. So as long as it's on for 6 hours or more, that's perfectly fine. Tomorrow morning, you're going to get up and wash your skin, dry thoroughly, and then you'll apply the first post-peel towelette to your face. And I want you to really work it into any areas where you have hyperpigmentation. So you're actually going to mimic a little bit the way I applied it to your face. You're going to just really pay attention to any problem areas or areas of concern. When you go to apply it around your eye area and your neck, I want you to use a really light hand. You never want to rub around the eye area. You're going to just gently pat it around the eye area and then do a gentle pass or two on your neck. So we want to be careful with those two more sensitive areas. So once you allow the post-peel towelette to dry down on your face, you'll go ahead and apply plenty of sunscreen, or SPF 30, if you're going out of the house or running errands or something like that. So you want to really protect your skin, especially for this first week post-peel. Typically, most patients start to peel after about 48 hours. It could be a little bit longer, but once you start peeling, you're going to apply the post-peel moisturizer with hydrocortisone to the peeling areas to help protect your skin and soothe the skin. And then tomorrow night, you'll use your second post-peel towelette. It's exactly the same as the first one. So you'll just cleanse your skin, apply the towelette all over your face, paying attention to any areas of concern, and then let it dry a bit before you go to bed. If you lay down with it on your face, immediately it's going to wipe off onto your pillowcase. So we really want it to do its job and to penetrate well. So is that pretty clear?
That's clear.
Okay.
That makes sense.
Okay, wonderful. I think you'll find the post-peel process is really simple and easy. It's really important, though, not to pick or pull at your skin post-peel. You want to let your skin shed naturally on its own. If you have any areas where you have like a long piece of skin hanging off of your face, which could happen, you can use a sterilized small scissor to trim that very gently, but please don't pull or pick at the skin. This can cause temporary scarring. So we just want to really kind of baby the skin for the first week post-peel. Okay. So you're going to avoid any hot showers, any heavy exercise, avoid swimming pools, saunas, that sort of thing. You want to just really be gentle. Don't use any extra products for the first week post-peel. You can use our kit that I'm sending you home with. You can use a mild cleanser, but otherwise, please don't use any scrubs or any harsh products on your face for at least 7 days. Sometimes when it's your first peel, it might take a little longer to peel. So don't be surprised if, since this is your first perfect derma peel, it might take 8 days for your skin to normalize. So just kind of pay attention to where you're at. Once you see that your skin is completely peeled and there's no residual redness or peakness, you can go back to your normal routine. So if you use like a retin A cream, for example, or a retinol or something like that, you can go back to that once your skin is completely healed.
Okay.
Okay.
We are so happy to welcome you to our family of providers.